Imagine you're roller skating or simply walking down some stairs, and suddenly you slip. Instinctively, you put out your hand to break your fall. Now, instead of just a sore arm, you find yourself in intense pain. You might wonder, is it a sprain or something more serious? It could be a fracture, one of the most common arm injuries affecting two very important bones, the radius and the ulna. In this video, we'll explore everything you need to know about fractures of the radius and ulna. We'll look at why they happen, what it feels like, how they're treated, and what you can expect in terms of recovery. So, if you're dealing with a fracture or want to know what to do if you or a loved one ever experienced this, stick around. Section 1, the radius and ulna, essential bones in the forearm. The radius and ulna are two long bones running from your elbow to your wrist, side by side. The radius is on the thumb side, while the ulna sits on the pinky side. These two bones work together to support the forearm and give it strength. When we brace ourselves during a fall, it's these bones that often take the impact. Section 2, what happens when you fracture the radius and ulna? So, what exactly is a fracture? Simply put, it's a break in the bone. But not all fractures are the same. Some are mild, while others are more severe. Whether it's a crack, a partial break, or a complete snap, the pain can range from mild to intense. Surprisingly, though, pain alone doesn't always indicate how serious the injury is. Sometimes, a fracture isn't visible on the outside, so you may not even realize it's there. For children and teens, there's another factor to consider: growth plates. These are areas where new bone tissue forms as they grow. A fracture here requires careful treatment to ensure it heals properly. Section 3, common types of radius and ulna fractures. Here are some of the most common types of fractures. Metaphyseal fracture. This type affects the upper or lower parts of the bone but doesn't involve the growth plate. Torus, or buckle, fracture. The top layer of bone compresses, causing the bone to buckle but not break apart. Greenstick fracture. In this type, the bone bends and cracks but doesn't break completely. Monteggia fracture. Both the radius and ulna are affected. This is a more serious injury that may involve a dislocation of the radius. Galeazzi fracture, often occurring near the wrist. This fracture impacts both bones as well. Growth plate fracture. This type is specific to kids and teens, where the injury affects the growth plate near the wrist. Understanding these types is crucial because the severity and type of fracture determine the treatment and healing time. Section 4, causes of forearm fractures. The most common cause of a radius or ulna fracture is falling onto an outstretched hand. But these fractures can also occur from car accidents, sports injuries, falls from heights, even weaker bones due to conditions like osteoporosis. For those with osteoporosis, even a minor fall can lead to a serious fracture. Section 5, diagnosing a fracture. If you've experienced a fall or an accident, and you're dealing with significant pain, it's best to seek medical help. The doctor may order imaging tests like X-rays or MRIs to determine if there's a fracture and, if so, what type it is. This is crucial in creating a treatment plan tailored to your injury. Section 6, treatment, surgical and non-surgical options. Non-surgical treatments. For simple fractures where the bone hasn't moved out of place, a doctor might recommend a cast, splint, or brace. This holds the bone steady while it heals. Over-the-counter pain medications like acetaminophen can also help manage pain. Healing is typically smooth, with most bones fusing back together without ongoing pain. Surgical treatments. However, some fractures may require surgery. This is often the case if both bones are broken, a bone has moved out of place, the fracture has punctured the skin. In surgery, a doctor will realign the bones and secure them with metal pins or plates. This keeps them in place so they can heal correctly. But surgery does carry risks, like infection, so it's generally reserved for more severe cases. Section 7, healing time and recovery. The healing process varies. Minor fractures might heal in as little as 3 to 4 weeks, while more severe ones can take up to 10 weeks or more. After the cast or splint comes off, it's common to experience stiffness. Physical therapy can help regain mobility and strength. During recovery, avoid activities that put too much stress on the healing bones, like contact sports or climbing. Once your doctor gives the green light, exercises like wrist rotations can gradually restore flexibility and strength. Section 8. Potential complications and how to prevent them. While most fractures heal without any issues, certain complications can arise, especially with more severe breaks. These might include infections. This risk increases if the bone breaks through the skin. Compartment syndrome. This intense pain occurs if swelling restricts blood flow to the muscles. Incomplete healing. Sometimes the bone doesn't fuse back completely, especially if treatment is delayed. Follow your doctor's instructions, take it easy, and consult with them before returning to any strenuous activities. For those with osteoporosis, treating the condition can reduce the chances of future fractures. Section 9. The outlook, recovery and beyond. With prompt medical care, the prognosis for most fractures of the radius and ulna is excellent. Bones often heal fully, and people can return to their normal activities within a few months. Still, it's important to listen to your body and not rush the recovery process. A little patience now can make all the difference in ensuring full, long-term recovery. Conclusion. So, there you have it. If you or someone you know ever experiences a fall and suspects a fracture, remember that timely medical attention is key. By understanding the types, causes, and treatments for radius and ulna fractures, you're better equipped to handle the situation if it arises. The road to recovery may have some ups and downs, but with the right approach, most people regain full function and get back to doing what they love. If you found this information helpful, consider subscribing for more content like this, and be sure to hit the like button. Thanks for watching, and stay safe.